Hi, today I want to go over the forms that you're going to need to complete and when those forms will be due. So I'm going to go through each one, and these forms will all be in Canvas. These first forms that I'm going to show you, there's fillable forms. So if you wanted to go in and fill these forms out, you'll need to save them and then send them to me. Or else you can just print these out and fill them out. There's going to be both fillable forms and also just print out forms. Same thing, just whatever works better for you. The easiest way to get these forms to me. So this one here is the case prep, and this is what you will do after you complete a case for the first time. So if you're working with let's say Dr. Johnson, and you do a lap chole, you're going to fill this form out. If you work with Dr. Johnson again and you do that same case, then you don't need to fill this form out. What you're going to fill out also is you're going to fill out this post-case analysis. And you'll fill one of these out for every case that you do. Okay, go back to the case prep. So again, you're working with Dr. Johnson, but you do a different case. You do an appendectomy. You're going to need to fill this out again. So in other words, for every case that you do for the first time with each surgeon, you need to fill out a case prep form. So yeah, I know you're going to do a lap chole with Dr. Johnson, Dr. X, Dr. Y. A case prep has to be filled out for each doctor for each new procedure you do with them. And then again, post-case analysis for every case. So every case that you record, you need to make sure that you do a post-case analysis. And then here's the log, the case log. And so for every case that you do, you need to fill this out. And of course, you're going to put the date, the procedure that you did, the surgeon that you worked with, and it also asks for facility. I haven't changed that on the bottom. It only includes the Farmington and Four Corners area. So for students that are in Alamogordo and Las Cruces, just put, just kind of briefly, you can put Gerald Champion, you can abbreviate those things. And then you will put what case it was. Was it general, GYN, urology, plastics, ENT? If you're not sure, you need to ask what type of surgeon you're working with, because general surgeons do some things that vascular surgeons do. They do some things that maybe ENT might do. So just check and see what kind of a surgeon you're working with. That'll help you know what box to mark. And then over here, you shouldn't have any observation. You should either be first or second scrubbing. So make sure to mark which box it is that you did, and then you need to have your preceptor sign. If your preceptor doesn't sign here, then that case doesn't count. And then the next thing is you need to make sure and sign here. So that is that. This here just shows you the amount of cases that you need. So for general surgery, which is one of the most important surgeries that you're going to do, you need a minimum of 30 cases. With general surgery, it's the only one that you can count more than 30 cases, but you have to have at least 30. Of those cases, 20 of those need to be first scrub, and then at least 10 will count towards second scrub. Okay, and then everything else, all these other cases here, those will all, you need to have. This isn't a minimum 90, but if you were only going for those 120 cases, which is the minimum that you need to have, you would get 90 of those cases. And it's in any of these. There's some things you won't see at all, like cardiothoracic. You probably won't see that, and may or may not see procurement and transplant. If you're lucky enough to see one of those, you probably aren't going to scrub in and help with that. And then diagnostic endoscopy, you can only count a total of 10 cases, and you will only be second scrubbing those cases. If you get the opportunity to do those cases, I do encourage you to do those, but again, you only count 10, and they're only second scrub. And then vaginal delivery. Some places that you go to might have you assist with the vaginal delivery, and those would be probably in Las Cruces. Around here, surgical techs do not help with those types of deliveries. So the minimum amount of cases you have to have is 120. Of those, 80 have to be first scrub and 40 second scrub. So, I mean, you're going to have more than this and this. And then this is the form that I need you to fill out, and I will need this after the end of each rotation. So for the first 2 rotations, those are 4 weeks, so I'll need you to fill out one at the end of the first 4 weeks, one, and then every time you end a rotation. So again, I put in 30 is the minimum for general, and then all these others, the maximum amount that you can get or that you can count. You're going to get more, but the only ones you can count is 15. So for GYN, all the other ones, urology, plastics, ENT, neuro, eyes, thoracic, vascular, the most you can count is 15. Almost always you're going to get more than that, and that's fine. That just gives you more experience in those areas. Again, endoscopy, if you do those, it's only 10 cases, and it counts as second scrub only. So I'll need that at the end of your 4th week. And then again, at the end of each rotation. So this paper here is just for a reminder for you what your minimums are, and also the areas that you're going to get cases. Evaluations. So this evaluation, and it's just called student clinical evaluation. Just ignore these numbers at the top here. Also right here at the end of weeks, just ignore those. What I want you to do is your first week of clinical, on that Friday, if you do work on a Friday, you need to have this filled out by the preceptor that you worked with the most. So have them fill this out, and then you'll need to turn that in to me. Okay? Now there's another one, and it looks almost the same. Oops, not that one. It's this one, student progress evaluation. This one you'll need to have done at the end of the rotation. So for your first rotation, which is 4 weeks, on that 4th week, on that Friday, if you work on a Friday, you'll need to have this filled out. Again, you want to have this filled out by the person that you worked with the most during your rotation. And it's similar, it just doesn't have as many questions as that last one that I just showed you. This one is a fillable form. Again, all these forms that are fillable are available either fillable, so if you had a preceptor and they have access to a computer and you want to sit down with them and have them fill this out, that's fine. They do need to sign this. So right here, if you would just have them put their name there, and then I can verify with them that they did indeed, they are the one who filled this out. You'll need to sign it, and then I'll look over this. This is a form that will be shared with the next rotation that you go to. So that way they have an idea of where you stand with the last clinical you were at. This will help them know areas that maybe you need to have a little extra help in, or if you're doing really well, then hopefully the preceptor at your next location will just kind of show you the ropes and then let you set up and first scrub everything. That's what I hope for. By your third and fourth rotation, you should be first scrubbing everything. And of course, each time that you change over to a new facility, you'll need a few days to kind of get adjusted to the way they do things, surgeon preference, and things like that. This case log is almost exactly the same as that other one that I showed you that needs to be filled out. The only difference with this form is it doesn't show the numbers of procedures, like over here where it says general, it doesn't show you 30. So you can either fill this one out or the other one. It doesn't matter to me. And this is another form that'll be shared with the facility that you go to next, because I want them to know the cases that you have been getting and the cases that you still need to get. Because if you're at a hospital and you did a lot of general and you go to a surgery center, you're more than likely not going to get general there, but you need all those other cases while you are there. So again, I want to make sure that you understand that when you're at a hospital, you need to make sure that you're getting your general cases. At surgery centers, outpatient surgery centers, it's really difficult to get general surgery. And because you have to have at least 30, make sure you get them when you're at the hospital. And ask for those things. You'll have to speak up and let them know what you need. They don't know what you need when you come in the door. All they know is that you're there to learn, and they're not aware of the cases you need. Me sending this form to the facility will help them have a better understanding of where you stand. So it'll help them hopefully to schedule you. But again, if they're putting you in, eyes or something, and they have general surgery available, then you need to ask if it's possible to be in that room. Sometimes that's not always possible. So just get cases that you can get and be patient. You're going to get everything you need. And if you have any questions about any of these forms, let me know. And again, these will all be on Canvas, available for you to print out. Or if you want to do fillable forms, that's fine with me. Just make sure that you save them, and then you're going to need to send those. For people that are out of town, you'll need to send those to me. And even for the people in town, it might be easier for you to just send me this paperwork. Case logs are due at the end of each rotation, so you don't need to send me those except for when you're done, getting close to being done with that rotation. So on that Friday. Case preps, you're going to do those every single day, and you need to make sure that you fill these out at the end of the day, because if you don't, you're not going to remember the details of that surgery. If you get the opportunity in between cases to fill these out, fill them out. Same with post-case analysis. I don't need you to fill out pages and pages about that case. I just want kind of a brief summary of what went on during that case. But make sure to put your name on these forms. Make sure to put the name of the case that you did and the date. Make sure that there's a date on here somewhere, okay? That way I'll know. Basically, I need to have a piece of paper for every case that you do to show that you did that case. All right, if you have any questions, let me know, and I hope that this video is helpful.